Have you ever heard of cerebral ataxia? You may ask, what on earth is that? My doctor, dad, and sister told me it's a neurodegenerative disease which affects brain motor functions and causes abnormal human movement. It causes unstable motor commands in a part of the brain that is called cerebellum. The cerebellum is the part that controls and organizes movement stability. Patients with cerebral ataxia disease have a very unstable gait or walking pattern. Now, let's talk about why current research is leaning towards applying AI with human motion. For instance, let's take a look at how a doctor assesses a person with abnormal gait at a hospital. For a doctor to diagnose someone with this disease, they need to do constant monitoring to the patient's movement, and after several sessions, they can confirm the diagnosis. Unfortunately, not everyone has the luxury and time to commute to the hospital and stay for constant monitoring, especially in the COVID era, where physical consultation is reduced. Moreover, gathering motion data from patients is sometimes difficult as well. Therefore, in order to compare healthy human movement with that of a person with cerebral ataxia, we can do something called human gait analysis. Gait analysis is the extraction of parameters of human joints and limbs movement. Extracting these parameters can be normally done by installing motion sensors on the patient and monitoring them. However, that is a very impractical thing to do. Why don't we make it easier? Well, it turns out that today's artificial intelligence can analyze human motion from just videos of patients walking in the scene without requiring them to commute to a laboratory or a hospital. So, if you draw a simple skeleton on a human body with joints and each limb represented by dots, and then you can plot the movement of the dots on several graphs, that's what basically gait analysis is, using deep learning library called pose estimation. By doing this for both healthy people and taxic people, you can see differences in the plots already. As someone from the engineering background, I can help the doctors and assess their diagnosis by developing a smart diagnostic classifier for cerebral ataxia based on human gait analysis. In order to build this tool, I need to gather two types of videos of human motions, which are the normal human motions and the cerebral ataxic patient's motions. I can then extract the gait movement from both types of videos and change it to graph plots. When doing my research, I found datasets consisting of normal human movements abundantly. However, the cerebral ataxia patients' videos are very scarce. So, in order to build a smart diagnostic tool, I need to make sure that I have enough data for the system to train on. There is when I have to introduce data augmentation in the system development. So, what is data augmentation? Basically, I have to multiply the data by copying the available data that I have and varying it a little, creating synthetic data from the original one. And then I have to put both normal movements and ataxic movements in the system, where it will learn from the data that I have fed, and the system will be able to classify accurately the gait type. After the training is done, the system should be able to recognize which one is normal gait and which one is ataxic gait. However, I still need to validate whether the system is doing the right job or not. Therefore, I have to put aside some data from the normal human motion as well as the patient's motion and test it after the system is complete. If the system is able to identify the correct movement, then the system is working as intended. To implement it, we need to utilize a camera at the patient's house and we can record the patient's movement. And then doctors can use this smart tool and the system can automatically tell the doctor the type of the gait of the patient. And if it's an abnormal gait, it will tell whether the movement is similar to cerebral ataxic movement or not. This proposed framework will definitely help the doctors in making their assessments, and it will also help patients who cannot commute to the hospital in order to conduct their diagnosis. I can also foresee that my system can be adapted with other diseases that are related to abnormal human movements as well. That's all for my presentation. Thank you very much for listening, and I hope you enjoyed it.